Joining us at this moment, live and exclusive, is Dr. David Nabarro. He's the Special Envoy for COVID-19 at the World Health Organization. Dr. Nabarro, terrific to have you back because you've joined us at a very important moment. There are several questions around where we are at in India, where we are at globally, and what needs to be done. I want to show you where India is at this moment relative to other countries, and then we'll get your sense of how you see India do. Okay, so here is the India graph on your screen right now. 52,987 cases in India. India is the orange line. So while other countries, and that's the crucial point to look at here, while other countries like China, even the United States to some extent, Italy, Spain have been able to plateau their curve or flatten their curve, in India the curve is still heading upwards, and that's of greatest concern to us. For the World Health Organization, Dr. Nabarro, where are you seeing India's position right now in the battle against the coronavirus?
Well, first of all, I'm really impressed, and I have said that last time, and I'm going to go on saying it. The speed with which the government acted when the first cases were found was exemplary. The attention paid to ramping up testing as much as possible in not the best of circumstances. I mean, we've seen just how difficult it is for most countries to increase testing, but you've managed to do so, and you managed to do it really fast. When I hear the numbers of tests that are being conducted, I'm impressed. And then thirdly, I'm also impressed that you're doing one thing that some countries have not really taken seriously, and that is you find cases and then you trace the contacts of those cases, and then you try to make sure that they isolate and don't go on transmitting the virus. So these are the sort of steps that are absolutely right. And then when I look at the statistics that I've managed to find from colleagues in the World Health Organization and also colleagues in the government of India, I'm really impressed that you got the virus in a number of discrete locations, and it's pretty much not spread beyond there. So obviously it's in Maharashtra, in Gujarat, Delhi, Rajasthan, Tamil Nadu, and I can understand that it's in some pretty focal areas in those states. But then I hear that in the majority of districts throughout the country, if you go to 750, 300 of them are green. And that's really good, because it means that what you've done through the lockdown is you've basically kept the virus and the people who are infected with the virus pretty well in place and not moving around, and that's super helpful. But the challenge will, of course, be what happens when the lockdown is released. You've got to release it because it has such appalling economic and social consequences. And I know you're going to do it in a phased way, but I think that everybody will need to be prepared for the reality that there will be some spikes of disease occurring, and that's unavoidable. And so what all countries are having to do now is, as they release their lockdowns, they also have to be ready to reimpose localized movement restrictions quickly in order to make sure that outbreaks, when they do restart, stay local. I know it sounds awful, but what we're seeing is that there are countries who've managed to move to this phase, Germany, for example, Singapore as well, and they are doing well. And we do listen to what's happening in China. I know that some people say, well, that's a bit tricky, but I'm going to say to you now that we are learning from our colleagues in China that they had to get the whole population on full alert after they'd closed down Wuhan, because as they released Wuhan, they were worried that there would be spread to other parts of the country, and so that everybody had to be on full alert for the possible re-emergence of the virus.
So let's build on that, Dr. Nabarro.
Yes, sir.
You're saying
yes,
we're
sir.
learning from global experience.
Yes,
what
sir.
are the lessons you think India should pick up from countries that are comparable? Now, when you compare, say, a Singapore, or you compare one of the European countries with less dense population, that isn't really a fair comparison.
I know.
This is the number of cases, the deaths that we are dealing with at this moment. The United States at 73,431. India still, as Dr. Nabarro says, doing much better, and may it stay that way. But what are the lessons, Dr. Nabarro, you think India needs to learn from how other countries have gone about trying to ease lockdown conditions?
All right, a totally new phenomenon for the world. And so when I say to you what I'm seeing in other countries, I'm also saying that there are a lot of things that other countries are learning from India. So first thing, really we have to recognize the virus isn't going to go away. So we've all got to be on alert. It's really something that every single individual in the country has to be aware of, that this virus is a continuing threat. And yes, people say, well, why don't we just put up with it and let the virus go everywhere and just live with it? I say, okay, that was a strategy that was adopted in some other countries, and they're living to regret it. That you cannot just let this virus go everywhere, because even the quite low mortality rate that we're seeing, if you multiply it up by the population of India, it would be extremely unfortunate. So I want to stress that we have to maintain consistent defence against this virus in all our societies and adapt our behaviour for it. There will need to be physical distancing where possible, but not everybody is going to be able to physically distance, and it's really tricky for low-paid people. So the second thing is, and we're hearing it from most countries now, face protection has to become a widespread habit. And it has to be worn really well, and it's designed to make sure that people who are asymptomatic but have got the virus are not spreading it to others. Last point is this, what I just mentioned, there will be further outbreaks that do occur from time to time in places, but authorities need to be able to respond rapidly. It's not nice, because it does require stopping people from moving out of a particular place and asking them to receive support from the authorities for their food, for their water, and for other such things, as well as for medical care. And also it requires very detailed investigation of who's sick and asking them to isolate. Now that localized and very localized confinement of particular areas is going to be necessary when outbreaks build up, and we all have to be prepared for it, and it's going to occur in every single country. Even where I'm living at the France-Switzerland border, I know that from time to time in the coming months, even if we get our lives back again and can start moving around, there will be a moment when suddenly a particular area is closed down and cordoned off because they have to deal with an outbreak that builds up. And that is what we're learning from other countries, and I think that there are things that India will follow, but there are also, as I want to keep repeating, there are many things that India is doing really, really well that other countries are following too. And perhaps the first is the speed of your response, and the second is the care that you're taking to make sure that poorer people are able to get food and are able to get basic needs when they're stuck between their workplace and their homes, and there's been some kind of shutdown, and they're in a sort of no man's land. I think the world will remember the courage and also the generosity of Indian citizens looking after each other during this very difficult time when so many poor people have found themselves short of cash and short of food.
I want to show our viewers next the day-wise breakup of how the number of cases is actually going up. Remember, you saw that comparison that we did between the Niti Aayog's projection of cases coming down by mid-May. On the contrary, the number of cases is actually going up, and the director of the All India Institute of Medical Sciences in fact said, Dr. Nabarro, that cases in India could peak by the end of June or early July. What's your sense of what the peak could look like? Because the peak is also relative to density of population, the total number of people in your country, and both those points, India has a lot of people. Therefore, when you talk about a peak for the pandemic in India, what is the WHO estimating, sir?
Well, thank you again for the question. Well, I'm going to really disappoint you, because the one thing I do not like doing is making projections of when things will happen or how bad they will be. And I mean, I do appreciate that we're still at a time when cases are rising, and I know that particularly in the densely populated areas such as Mumbai, some areas have been really, really difficult because of the rapid spread and the difficulty of isolating and stopping transmission. But and the last point, sorry, is that as the lockdown is released, there will be more cases, and we just don't know how intense any rebound outbreaks will be. And it depends on luck, and it depends on good planning. And the planning will be there, but some will be whether or not you just get a bit of bad luck. So I am anticipating that there will be some more cases coming as the lockdowns are released. But then I'm anticipating that you will move in. Secondly, I believe that it will be possible within India to establish movement and communication in a good way, so that people will be able to move around and take holiday if they want to. The challenge is going to be, for this world, the international aspect. How will countries establish the protocols for air travel particularly, but also, I want to add, for sea travel, so that people can move from one country to another without being held up at borders and made to go into quarantine for 2 weeks or such things. Partly that depends on the nature of the dialogue that goes on between countries and whether or not we can get trust so that it is possible for a more free movement. We're hearing now about what's called travel bubbles starting to emerge, where countries that have developed a trusting relationship with each other are starting to also establish flights and communications. And that's good. But I think the most important thing for everybody is that it will be some time before international travel returns to anything like the pattern we had before, simply because we don't have the international protocols yet established for what will determine safety with travelling with this virus in our midst. And that's where I think the role that India plays on the international stage is going to be really important. I think it's key that every leader has got to say to other leaders, we can't just let ourselves wait until somebody else will find a solution for some of these challenges of how we will travel between countries. I'd like to suggest that in international forums, that Indian leaders, when they're participating, team up with other leaders and say, look, we're going to get our staff at the highest level sitting down together to try to hammer out the protocols for travel that will enable us to be sure that we're not going to get people held up at borders or at security or whatever place is going to matter. Because unless we get everybody working together on this, it's going to be quite challenging. I hope that's helpful.
Okay, what are you making of the various lines of treatment? Remdesivir, which was originally developed to treat Ebola, now getting some kind of emergency sanction. Mycobacterium W, which was developed for leprosy, is also being looked at. So various treatments being bandied about. Which of those do you think works best? What's your sense at the WHO, sir?
Thank you very much indeed. There are two ways of looking at this treatment question. One is to say, have we got a cure? And then the second is to say, have we got ways of reducing the intensity of disease? We don't have a cure. And I'm not sure that we're going to get a cure in the near future that's 100% effective and doesn't have side effects. So have we got ways of reducing the intensity of infection? As you said, there's positive signs from remdesivir, and there are suggestions that hydroxychloroquine can reduce the intensity of infection in some places. It's been quite controversial. And then there are other drugs also being talked about, as you mentioned. We're not going to really get, I think, detailed what we call randomized controlled trials of these kinds of treatments done right in the middle of the COVID pandemic. But we are getting more and more observational studies from practitioners, and these observational studies are being collated by the World Health Organization. As of now, as you said, remdesivir has some promise, but other ones still don't appear to be offering the kind of results where we can say, yeah, this is a good one. So that's the kind of situation right now. Some promise from one, some uncertain data from hydroxychloroquine, and otherwise we don't seem to have yet drugs coming forward. I am hearing about some suggestions that there may be drugs that modulate the immune response of individuals that could be some help. And if that comes forward, then I think that offers some promise, but it's still early days. But I do know, I'll tell you this, that we've seen scientific cooperation between medical people and between researchers like I've never seen before. There's none of this competition between people and refusal to share data, not at least among the communities I'm working with. So I think I can reassure viewers that if there is any kind of treatment that really is going to make a substantive difference to people with COVID, we will make sure that people hear about it at once, no delay at all. Because like everybody, we all want to be sure that we found the best possible treatment for people with the disease and we can reduce mortality to as much as possible.
What about the battle for the first vaccine? Now we're seeing various medical claims and breakthroughs being announced in Italy, in Israel, in Oxford. They're saying they'll have a vaccine ready for the world by October. Is that vanity? Is that a sense of competition? How are you looking at these various claims coming out of different countries? Which ones do you believe hold the greatest promise, and when can we benefit from them?
Well, thank you for that. I like to talk about vaccine in stages, and I'm going to take 3 stages. Stage 1 is finding the candidate, the substance that can be put into a person that will help them to fight away the virus if they get infected in the future. You see, we're relying on the immune system of the body. We're priming it up so it's ready to deal with this virus using this vaccine, which is a derivative of the virus. And we're making the body super strong when it gets attacked by the virus. And so to find these candidates requires quite a lot of work of isolating different compounds. And there are very many different, what we call vaccine candidates that have appeared, some of them looking quite promising. And so stage 1, finding the candidates, looks good, very good. Stage 2 is then to test this candidate vaccine through a number of different pathways, and they're quite well written out what you've got to do in the tests. You do have to study in animals, it's part of the procedure. Then you have to study in human volunteers. Then you have to take it to a population of humans and challenge them with various different stimuli to see whether or not they do respond and respond well. And then at the next stage, you take it to very large population studies, what's called the phase 3 trial. That's the middle phase, is the testing it out. And that's where most candidate vaccines hit the buffers, really. That's where the problems arise, because first of all, you've got to check to see the vaccine interaction between vaccination and something else going on in the person that might unfortunately lead to them having a bad side effect or even to death. And that's where every single precaution has to be applied, because everybody knows that if you've got a vaccine and it actually has bad side effects, then that really is a terrible thing. It will just not only upset people, it will actually make them really angry.
Sure.
And we don't want that.
I think you have the ability to put things out with more clarity than virtually anybody else, and that's why we're so keen on having you on our network, Dr. David Nabarro.
I talk too much, though.
No, you don't. There's so many questions in everyone's mind, and there's so many different answers we hear. It's good to see the kind of clarity about what you can say and what you can't. Both hold so much meaning. Dr. David Nabarro, for taking out time from a very, very busy schedule and joining us, thank you. And thank you for the effort you and your team are making. I realize you're under a lot of flack globally, but this is really when you don't hit out at the firefighters, you let them do the job. I think that is most important. Dr. David Nabarro, for joining me on the news track. Thank you, sir. And
thank you very much. Thank you. Bye-bye.
Thank you. Goodbye. I hope to have you back soon. Thank you. Hello, everyone. This is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.